All right, this is Sean Callahan, aka Mr. Hospital Bed. We're doing a series of videos to help give you a little bit more information about hospital beds, hospital bed features, what they do, how they work, and give you a little bit of knowledge and insight on that. And I've done quite a few different videos, but I'm going to start doing some that are a little bit more tailored to very specific questions and answers. And today we're going to talk about air mattress systems for hospital beds and what features air mattresses offer, what to look for when you're buying an air mattress system for a hospital bed, and give you an understanding of how they vary in price, why they vary in price, and kind of get into that. So this video really specifically is really geared for air mattress systems for hospital beds. Now, if you've watched some of my earlier videos, air mattresses are really primarily made for people that spend the majority of time either laying in bed or sitting down. So, a lot of times people say, well, I'm only in bed 10 hours, but what are you doing? You're getting out of bed and sitting in a wheelchair. So, is there ever a time where that part of your body is ever getting relief? Not really. So, in my world, you might be able to get away with using a foam mattress for extended periods of time, and maybe that'll work. However, um, the number one reason people get readmitted into a hospital is because they've gotten a bed sore. And so bed sores are, kind of something you need to keep your eye on and something you have to kind of be aware of. And so, air mattress systems really are designed to do several different things. But the first thing is bed sore prevention. If it's gone into a situation where there already are bed sores, then it's going to be bed sore removal and getting those dried up and trying to get everything fixed. So the first thing we're going to talk about with the features of an air system are going to be, why an air mattress? I mean, what is an air mattress doing that a foam mattress isn't doing? The first thing that it's doing is it's allowing the body to be absorbed more fully. The mattress is covering a wider square footage of your body space. And what that does is it reduces putting pressure on smaller points of the body. So, as an example, I was just talking earlier about the bottom of the heel. Well, if you're putting your foot down and the majority of the weight of your leg is being absorbed on the heel, on a foam mattress, it might only be the size of a dime that's enveloping that whole area. So your foot's going on the bottom of that mattress, and it's just too much pressure on that small area to maintain. And eventually, two things break down skin: primarily friction and moisture. So with the heels being down there and moving around, with the body weight being there and building up moisture because you're not getting really any circulation under that area, the bottom of the heel, the tailbone, and in some cases, even the bottom of the elbow are going to be the areas that are going to be the primary areas of concern for getting a bed sore. So when you're on an air mattress, instead of the tip of your elbow going in, your whole elbow is going to be enveloped. Instead of the bottom of your heel, being on that little bit of an area, the whole heel is going to drop in. And what that does is it extends the area of contact with the mattress, and therefore it doesn't put a lot of pressure on such a small little area. So that's the first thing that an air mattress is going to do. Now, gel foam mattresses, which I've talked about, and I've got one right above my head, and I have to use my opposite hand. And this is kind of funny. It doesn't see me do that, but that's a gel foam mattress that has a pressure redistribution um, copper on it. And we're going to talk also about foam mattresses later. But now that we're on the air system, that's the first thing it's going to do is it's going to envelop that part of the body and get you deeper into the mattress. But the most important feature, and the feature you're going to hear about the most, is going to be a feature called low air loss. And low air loss on an air mattress system is basically air that's circulating over the surface of the mattress, which is whisking away moisture to keep the skin dry. And so when that air circulates over the surface of the mattress to keep the skin dry, what it's doing is it's basically also helping to mitigate moisture buildup, and it's helping to mitigate in many cases also because the fabric or the material being used is what we call no shear. No shear meaning that when you're sliding on and off it, it's not causing a lot of friction on the body. So an air mattress system automatically, when you've got low air loss and you're setting that up, you're using for the most part a different type of material on the top that's reducing friction when the body is moving across the mattress. Now, low air loss is, as I said in other videos, is only as good as the size of the pump and the size of the holes in the mattress. Now, with the progressive bed behind me, it's got two big tubes that are down at the end, and that's just pushing a massive amount of air over the surface of that mattress. But most home care and even high-end hospital grade air systems are going to have 18 air bladders, and those 18 air bladders from the top to the bottom on the far left and the far right are going to have little holes, and some are really tiny, some are bigger, but the better the quality of the mattress will equivalent to larger size holes and more air being pushed over the surface. And with some of the hospital grade equipment, you might have one hole, starting up by your head, and once you get down to the midsection, you've got two holes on each side because they're trying to push and run more air over the surface of the mattress in the areas that are at high risk. And it's also important to note that if you are on an air mattress system, you only want one full cotton fitted sheet on that mattress. If you've got multiple sheets and whatever, it's going to mitigate, and it's going to neutralize the effectiveness of that low air loss. But low air loss is going to be the number one feature that you're going to hear. And why is it important? Once again, by running air over the surface of the mattress, the goal is to keep skin dry, prevent bed sores, prevent skin breakdown. Now, air mattress systems also will have a alternating pressure where, depending on how the air bladders are set up, it'll alternate. So one inflates, one deflates, one inflates, one deflates. That's also a fairly standard feature that's going to come with most home care type mattress systems. It's not always used, but normally it is there. And so you've got the alternating pressure, and that changes the pressure points of the body making contact with the surface of the mattress. So that's also something that's important, and it's very useful. On a hospital grade air system, however, it's going to be every third air bladder that'll inflate and deflate. And the reason being is that when you're using every third air bladder, number one, you're getting more pressure relief to the areas that are not making contact with the surface of the mattress, but you're also keeping yourself supported on two-thirds of an air mattress instead of the lower tiered ones, which are 50-50, which leave half the mattress inflated, half the mattress deflated. And that's really why some mattresses are more expensive than others. And as I've said in previous videos, you can get into low air loss mattress systems for $500, and it's a tiny little box and tiny little holes, and the amount of air that's circulating over that mattress is never in 100 years ever going to prevent somebody that's permanently bedridden or spending the majority of time in bed from getting a bed sore. There's just not enough air being pushed over the surface, not enough air coming through that mattress to really make a significant difference or to help anybody. So that's going to be another feature that you're going to look at. Now, on a higher tiered air system, you're going to get into something called lateral rotation. And we talked about this in a previous video, but once again, this is just about air mattress systems. Lateral rotation is another set of air bladders that inflate and deflate. And what they do is they turn the person left, right, center, and it basically allows people to shift the positions of the body that are making surface contact with the surface of the mattress. So, that is another feature. And I'm going to show you that feature because we've got the Hillrom progressive bed. The progressive bed behind me is by far, not even close, the best hospital bed made on the planet Earth. And this hospital bed is it sits into a full chair. This is the highest level of patient care you get in a hospital, and we sell these into homes, and we sell these into long-term care. But this is the best of the best. But you can piece it together. You don't need a progressive bed to get lateral rotation. The um, you could get the over here. You could get the Striker Secure 3, which is also a great bed, and you could buy a brand new air system and put it on there. And you could also get the lateral rotation that way. But it's understanding, do you need that feature? And if you do need the feature, you're moving into a higher tier, a higher level of patient care. And any mattress system that has lateral rotation is automatically going to have a very high level of low air loss, because they know if this mattress is being used to turn somebody who's immobile, then it already needs to have a high level of patient care. So there are high tiered home care medical mattresses that we'll sell. And then, of course, we do sell a lot hospital grade stuff because we do sell also to hospitals, and we've been doing this a long time. and we're very familiar with wound care treatment surfaces, and that whole subject of what you really need and why it's important and what's the difference between hospital grade or higher end patient care and lower end patient care. Generally speaking, a lot of the stuff that comes from insurance, not always, but a lot of the time, is not going to be the highest level of patient care. And many times, what happens is people get home from a hospital and realize this is probably not going to work. We're going to need to upgrade. And there's a whole nother process that goes through that. But to make a long story short, lateral rotation is also another feature that goes with low air loss and alternating pressure. Now, the third or the fourth, and probably one of the highest level ones, is going to be a percussion vibration feature, which I'm going to demonstrate. And percussion vibration is a pulmonary feature, meaning it's for the lungs, and that's going to be able to knock out congestion and knock liquid and move the lungs and kind of almost do what a respiratory therapist would do, which is sort of patting you on the back to help move that fluid and that congestion out of the lung area. So with that being said, um, you can get a bed like the one behind me that has a lot of these features built in. We sell the Hillrom VersaCare bed. We have the Progressa. The earlier version of the Progressa is the Hillrom Total Care Sport 2, and that's also a great bed. However, it is at least 10 years old because they haven't made those since 2015, 16. And it was a hydraulic bed that had hydraulic parts in it. So normally it requires more service than some of the other full electric beds like the Progressa. The Progressa really is a remodified version of the Hillrom Total Care Sport, but when they re-engineered the bed, they got rid of the hydraulics, made it full electric. Therefore, it is for the most part much more reliable. So, with that being said, let's just take a quick look. Now, not all of the lateral turning features are going to work the same. On some of the basic higher end home care mattresses and even hospital, it's going to turn the person at a 40-degree angle. 40 degree is a clinical angle that they support that is for them going to be exactly what that person needs is at least a 40-degree turn. And it's going to be an on-off switch. It's going to be very easy to use. With the Progressa, we've got a touchscreen system. So we're going to just take a real quick look at that and and then just go into talking about this. Now, there is also another feature which I'll get into here. Let's just make sure that I can fix the camera side here, people. There we go. Get nice and tight on that. Okay, so we have turn assist left and turn assist right. Now, this is just a temporary turn where it's going to turn the person to the left and then it's going to bring them back. Now, we have a model of a bed called a VersaCare, and the VersaCare bed is going to you can see you can hold that. The VersaCare bed is going to do turn assist. Lateral rotation, however, is going to be something that's going to go all night long. And so I'm going to go into the rotation feature so you can see that. And the lateral rotation, if I get in here, I can determine how often I want the person turned. I can go in and determine the degree of angle. So 40 degrees, if they say I'm more comfortable at 60, I can move it to 60 and then I can hit start and I can very much, and then boom, all I did is hit start. And now the mattress is going to start turning that person until the time I say stop therapy. So that could be, for the next hour, 2 hours, 10 hours, however long, we need to do it. But generally speaking, usually at night when the person's going to bed. So and you can see the mattress, like half of it's inflating. You can see that it's this backside over here is inflating and it's turning that person. I'm going to go down here and go to stop therapies. And yes, I'm sure I want to stop. Let's see if I can get tight in there. Okay. And then what I'm going to do is just go back, hit the back button. I'm going to go to P and V, which is our percussion vibration. And now what I'm going to do is I'm going to go ahead and hit start. And that's going to basically activate the pulmonary system, which I'm going to get into here. And hey, Christine, can you grab me a footboard? Just a board off one of these beds, if we can find a small one. Yeah, that one's kind of big, but that'll work. Oh, no, no, no. There should be one just laying on the bed side. Oh, perfect. And we have such a great staff here. Thank you so much. These things are heavy. A little bit. Yeah. But we're going to put that on there just so you can get a better visual. And you can see what it's doing is it's literally, thumping the upper respiratory system. And so this is going to be something that's going to help break up the congestion in the lungs. See if I can get a better angle of it there. But this is what we call P&V or percussion vibration. And that feature, and we're going to go back in here again. We're going to stop therapies. And yes, I am sure. And you can see here in our showroom. Thank you so much. And there might be a time also when you're talking to Christine or you're talking to Abby, who are two of the fabulous coworkers that I've got here that make everything happen in this place. But the P&V or the percussion vibration feature is really used a lot for people with ALS, MS, COPD, various different things. Um, I got to figure out how to get the focus back here. But those are going to be features that you're going to look at. Now, not everybody needs that. And the goal of the video is to say, Matt, we won't need that, which is perfect because if you don't, you're buying exactly what you do need, and more than likely you're saving money or finding options. Now, we do sell mattresses, brand new air mattresses for hospital beds, and then you can buy them when they're built into the bed frame. Normally speaking, you're going to get, in many cases, a better value buying like a Hillrom VersaCare bed with an air system built into it because you're integrating that. And there's certain bed models that are very reliable. There's certain bed models that are not so reliable. There's beds that are in here that you're not going to see me sell because I don't personally like them. I mean, we go through beds by the thousands. We're sitting on over 1,000 hospital beds right now in our Virginia warehouse. So, and we've been doing this, I've been doing this over 15 years and we do it for hospitals. And, so the main thing is over the years and working with all of our technicians here, there's like, you know what, they didn't do a good job on that bed. I'm not going to name any, but there's some beds like a VersaCare. Now people will say to me, "Hey, what's the age of the bed?" And I'll look at them and say, "Well, that's whatever the age is," but that's not really a determining factor. The determining factor is that did they do a good job engineering the bed and is it reliable? Or is it a bed that they made a few mistakes on that maybe was they compromised the quality or maybe they tried to push something out too fast to appease shareholders or who knows what. But there's a few beds that you will not see me sell because I don't find them to be reliable. Personally, I think they're higher chance of having issues. But sometimes people call and ask for them. Just say, look, that's a good bed, but I've got one that's going to be a better, more reliable fit. And so with the air mattress systems, most of the beds that have air mattresses that we sell are really good beds. But like I said, the Secure 3 over here, it's always funny because I'm opposite of what I'm looking at. That's a rock solid bed. That's one of my favorite beds. It's really durable, very reliable. I can throw that gel foam mattress on there. I could throw an air mattress system on there. And then I'm coming in at a lower price range, but I'm still giving the customer what they need, which is a very high level of patient care and a very good quality medical bed. My thing is personally, I'm not selling you anything I personally wouldn't sleep in. I've slept on gel foam mattresses like that striker right there for over 6 months, and I love it. Of course, there's times when through transition and moving, it's like, "Look, I don't need all this right now. I just, throw that on a basic, bed frame, and I'll just be fine with that until I, get time to fill up another room." But that's the whole thing. The goal here is to provide you really good information, to give you information about what is an air mattress, why there's a difference between low air loss at $500, $600 and a hospital grade low air loss system with a big pump running a lot of air, drying up bed sores or preventing bed sores. And we try to work with every person to find the best fit for them. Every bed is different, every patient need is different, every budget is different, every location in the country is different. Our goal is to provide you with as many options, and we do sell a lot of home care beds. And like I said, we deal with high-end home care, not Mickey Mouse, the cheap stuff. I don't. There's plenty of people that'll sell the cheap stuff. I don't need to be another guy out there selling these low-end mattresses that personally I don't like, that I don't find to be very effective, and that I personally feel, even if you get that, if you're in bed and you're sitting now, that might mean, you know what, maybe I need to give somebody a deal on a VersaCare bed because they need a high level of patient care. We got to come in at a price range that's going to be effective for them. So there are times where we do make the adjustments. I want people to get what they need based on the level of care that they need. And like I said, we try to find stuff that's affordable in every price range. So we're located in San Diego, California. We're located in Richmond, Virginia. We ship beds all over the United States, all over the world, actually. So we're very well versed in this. My name is Sean Callahan. I'm going now by the name of Mr. Hospital Bed, which I find to be very funny. If you follow my channel for a while, I've got hundreds of videos on YouTube. I've got 3 different YouTube channels. I also do a lot of other medical equipment. Um, and I've been doing this now for over 15 years. So some of these videos, you've heard my voice, but you haven't actually seen me as a human. And so I decided that I would jump in front of the camera and just start to meet and greet and just give people that information because I talk to people all day on the phone. And my goal is, like I said, is to try to take care of people when they're in their greatest need and give them the highest level of patient care possible, for the budget and for the needs that they've got. So if you need a hospital bed or you have questions or you've seen one of our videos, you can call our San Diego location at San Diego location is 858 263 4894. Richmond, Virginia, 540-327-7376. We've got multiple websites out there, but the number one, just the numeric number one in the word hospitalbeds.com is one. And then Hospital Bed Shop is a second one. You can find those in the description area. Feel free to call us. Feel free to ask questions. We do basic delivery, white glove delivery. We basically can have all different types of options. But today I wanted to do a quick video on air mattress systems for hospital beds, what to look for, what are the features, what are the options, what do you need, what is the difference, why is one $500, why is the other one 1,000 or 12,000 or not, nothing's 12 grand. But you get the point. So thanks for watching the video. Subscribe and share. Feel free to call us if you have any questions, and we'll look forward to seeing you on the next video.